Right now in Poland, over half of the adult population, nearly 56%, is living with excessive body weight. That number is severe on its own, but the data on younger demographics shows an even steeper incline, with rates of excess weight among children and teenagers climbing higher every year. Despite these massive population-wide figures, society routinely treats weight gain as an individual moral failure. The prevailing narrative insists it is a basic failure to balance calories in against calories out, a simple lack of willpower. This diagram outlines how that stigma translates into daily life. We see a clear cycle of public shaming, where individuals are mocked with derogatory labels, which inevitably pushes them into profound social isolation and depression. The shame generated by this environment actively deepens the crisis. People experiencing this level of social rejection frequently avoid the medical system entirely out of fear of being judged by their own doctors. To reverse this trend, we need to abandon the idea that excess weight is a character flaw and treat obesity as the complex, multifactorial chronic disease it actually is. For millennia, human survival depended on capturing and storing as much energy as possible to survive periods of extreme scarcity. Our bodies evolved to be incredibly efficient biological hoarding machines. Today, those ancient biological mechanisms operate in an environment that actively enforces a sedentary lifestyle. We sit during our commutes, we sit at our office jobs, and we sit for entertainment. Simultaneously, we are surrounded by a constant supply of cheap, highly processed foods, engineered to deliver massive surpluses of calories with minimal nutritional value. The resulting weight gain is the predictable outcome of dropping ancient bodies optimized for scarcity into an environment optimized for excess. This graphic maps the split between physical and emotional hunger. Physical hunger builds gradually, as a biological request for fuel that naturally shuts down. Emotional hunger strikes instantly, ignoring a full stomach to demand highly specific, calorie-dense comfort foods, making it incredibly difficult to stop. The brain uses high-calorie foods to trigger dopamine, effectively putting a mask over negative emotions like stress. But the relief is brief. The dopamine hit is immediately followed by intense guilt and shame, creating a feedback loop that triggers another episode of emotional eating. These neural pathways often form early in life. Well-meaning parenting strategies, like offering a cupcake as a reward for finishing dinner, inadvertently teach the developing brain to associate food with emotional comfort and behavioral reward. Chronic overeating is rarely a conscious desire for more calories. It is the brain's desperate, hardwired attempt to regulate emotional distress. Because obesity stems from an intricate web of biological and psychological factors, treating it requires clinical medical intervention, not societal judgment. The condition officially crosses into disease territory when excess body mass begins disrupting daily life, bringing on symptoms like chronic fatigue, joint pain, or sleep disturbances. While doctors often use a body mass index over 30 as a starting threshold, it is strictly a screening tool. Because it only divides weight by height squared, it has massive blind spots, completely ignoring age, gender, and muscle mass. To get an accurate clinical picture, the critical first step is a visit to a primary care physician. This shifts the burden off the patient's shoulders and places it into an objective, medical framework. A doctor will map the disease by running 5 core diagnostics: measuring waist circumference for metabolic risk, checking fasting glucose for blood sugar, assessing lipid profiles for cholesterol, testing TSH to ensure the thyroid is functioning, and evaluating liver and kidney health. From there, a real treatment plan focuses on long-term adjustments to diet, movement, and sleep hygiene, completely avoiding restrictive crash diets that inevitably fail. For severe cases, doctors rely on psychotherapy, targeted pharmacotherapy, and bariatric surgery. These are scientifically proven medical tools required to reset a compromised system. By treating obesity as the chronic illness it actually is, we strip away the guilt. We empower people to seek effective medical care and replace a culture of public shaming with one of sustainable healing.